The show must go on. We've done it from the beach. We're doing it from the airport right now.
By the time I was 11 or 12, I knew I wanted to be a doctor. And I was playing boys' little league my whole childhood. Oh, honey, you better make sure that you find a rich husband. I don't need to do that. I'm going to be a doctor. I'll be able to afford whatever I want myself. Don't try to get in an argument with any of us. Like, we'll talk you down forever. Like, you will never. We were fending for ourselves a lot as kids. And I think that created a sort of grit and tenacity that we share and live with even now. I became a responsible person at a very young age and carried that with comfortably in a way that also set me up to be creative minded from an entrepreneurial standpoint and also unafraid to take chances.
Autoimmune diabetes affects the whole community. It doesn't affect just the individual that has to live with it. It affects the siblings, the parents, the school bus driver, the teacher, the counselor at the camp. Everybody has to be aware of what's going on with this one child or adult who needs to monitor their life 24 hours a day, 7 days a week.
If you have even one person who provides that positive connection and safe, you can have better outcomes, protectors, essentially, to provide that cushion. My family sued to have me be allowed to play on the boys' teams. I was a very good athlete. And so once I was allowed to play, they didn't mind it so much because I was good at it. It just stuck in my craw, the idea that I was going to have to hook my train to some rich guy. I talked to my partners at the time and said, I'd like to begin to do some house calls. I'd like to see them in their natural environment. I was convinced that by creating a closer connection with families, we would actually reduce the burden of call because if families understood they could get a hold of us anytime they needed us, they would actually need us less. I created exam rooms that had no tables. They all had couches and like little lounge chairs so that people felt like they were in a living room space. There was never a waiting room in my office and hasn't been ever since. As soon as the early Israel study came out, we moved. So it was using evidence to move toward a holistic approach. And that's, you don't make much little revenue.
How many did you do in a day?
Yeah, it would vary, right? Some days, none. Some weeks, none. Parental stress over time. And even the Surgeon General now with the warning and, alarm bells being raised about parental stress. If you really look at the drivers, it's this intense parenting that is part of the challenge, right? It's tiring. It's really exhausting, but it's not that complicated. So if the only reason you thought something was wrong is because you opened a diaper or unsnapped a onesie, there's nothing wrong. I don't care if there's a rash. I don't care if the poop is green.
With children, it's pretty simple. If you feed them, they probably will grow well.
Learn how to embrace who they are as a whole person with this chronic condition. The severity of the disease is very different. How soon kidney failure occurs is years and years different. Like someone may be going for the first kidney transplant at age 11 when you wait to get diagnosed until you're 9 months to 2 years. Whereas if you begin cysteine depleting therapy right after birth before symptoms appear, you might get to 20 before you would need that.
Kid was white as a piece of paper. Shocky, sick. I didn't know what he was. Called 911, called the ER, said, I don't know what this kid has, but good.
The goal of the newborn screen is to identify children who, without intervention, would have life-threatening or permanent disability if not discovered in the first weeks or month of life. I'm working on some suicide prevention work with them starting in the new year. And they've got a grant and we haven't figured out exactly what the output of that grant is going to be, but we're going to be working together to do some suicide prevention work, legislative or congressional requirements of the tech companies to decouple the algorithm so that children and teens no longer will be automatically fed down into a rabbit hole. You do, but the data doesn't go away. It's still stored somewhere. So what this would allow is for the tech companies to actually delete it.
What do you do when you find out somebody has the genetic makeup to have Wilms? You check the kidneys out? There is no cure.
Polygenic conditions mean that it's not just one letter in one book. You've got to have a bunch of books with things that are miswritten before the condition can occur. In the case of a monogenic condition, it's a popular book. It's a hot pick in the library. So it's read all the time. Whereas in a polygenic condition, those books aren't always read. So something has to make it popular. Oprah picks those books. If this book is a hot pick and there's like a lineup of people waiting to get this book out of the library, meaning that 100% of the time this book is out of the library and being read, that's 100% penetrance. Right now, there are over 700 conditions that present in early childhood that have treatments. Nurture's only screening for 413 because the rest have variable penetrance.
And so when they see the tumor, they go in and they just excise
Right, they
the
take it out
tumor.
when it's the size of a pea instead of waiting until you palpate it.
I've yet to meet a mother who's had to find out that their child is going to live with T1D when they collapse on their waiting in their family room or in the PICU with DKA that does not say, why did my pediatrician not screen my kids?
The severity of the initial presentation, even if that weren't possible, right? Just knowing that you can change disease trajectory through early intervention allows a parent to be feeling as though they are in the driver's seat. Do you tell every newborn, go get disability and life insurance for your child? You can't get disability insurance for a 3-year-old. You know what I mean? You just can't. You can't get life insurance for a 3-year-old.
They can disqualify you for disability because you went through a divorce and you became depressed and somebody wrote in the chart that you were depressed post-divorce. And that's it. They don't want to insure you because you're a suicide risk.
Right.
Insurance is about assessing risk and actuary tables. And if you fall
But
under the
I can tell you that I've seen pneumonia this year than I have seen in my practice life ever.
I think the microbiome is going to be fascinating, not only in mental health, but metabolic disease, obesity, type 2 diabetes, allergic conditions.
Yeah.
I think we're not even seeing the iceberg. We're just seeing the little
I
tippy
agree.
top.
Kids who have high processed food diets are more at risk for mental health conditions like depression and anxiety.
The community as a whole is not being paid to do the work they need to do. How do you think that has a negative impact? And
I think that we're going to come to a reckoning in primary care as a whole. Time shouldn't be the metric. Complexity needs to be the metric.
we need to recruit the best into the specialty of pediatrics. That means that they have to be paid $350,000 a year. And I'm not ashamed to say that because that's what the average physician makes in the US. They want to talk about value-based medicine, which is an acronym for how do we cut down the cost of taking care of chronically ill people who are at the end of stage and not the investment that our youth needs to be able to be successful. If we have so much wealth in this country, we can do better for our children.
In order to become a real pediatrician, you should be able to see in the sea of 100 normal, the one that has Wilms tumor. We have to respect our own profession a little bit. And
Yeah.
give it away. We're
Yeah.
giving it away to 23-year-old extenders that really have no experience.
A fever could just be influenza today. It could be strep tomorrow. It
Mhm.
could be
Great. The next day.
diarrhea. It could be
Yeah.
a drug reaction. And that becomes so much trickier. You could definitely train a PA or a nurse practitioner, and they could do a lot of the follow-ups, and you
Yes.
could work with them. It's asthma, same thing. It's just over and over again, education, doing the same thing, following these parameters.